Hello, and I am Alexander Adams, and here with me today is Dr. Randy Becker, my uncle, who is the medical director at Crossroads Imaging Center, director of marketing at Advanced Radiology, and director of MRI at Baltimore Washington Medical Center. How are you today?
I'm doing fine, Alex. Thank you. How are you?
I'm doing fairly well.
Good.
So, Dr. Becker, what exactly is radiology?
Well, this is a very good question, and not many people actually do know what radiology is. It's a discipline in medicine where a physician uses predominantly imaging to look inside a patient. And by using that imaging, it helps us make a diagnosis of what potentially could be bothering patients. We can use CT, MRI, X-ray, ultrasound, and even nuclear medicine, as well as angiography to help us make diagnoses on patients.
Okay. So, what is your typical day like? Or for
Typical
just...
day, that's a good question. Personally, my typical day is I'm a diagnostic radiologist. And what a diagnostic radiologist is someone who predominantly interprets films as opposed to an interventional radiologist, which is someone who will do interventions on patients. For example, biopsies, for example, infusing chemotherapy, which is medication for cancer in patients, or injecting contrast in someone's blood vessels. So for me, as a diagnostic radiologist, I will be assigned a group of work, which can be CAT scans, MRI, X-ray, ultrasound, and I'll be asked to interpret those images. I predominantly read MRI, with my specialties being neuroradiology and musculoskeletal imaging, so head, neck, and spine, as well as orthopedic radiology. I will start with a morning of anywhere from 20 to 25 MRIs, usually continue through lunch, and in the afternoon I will usually do anywhere from 1 to 3 orthograms. An orthogram is where we inject a small amount of contrast via a needle in a patient's joint to help us get a better idea of the anatomy. And at the end of the day, I'll probably interpret a handful more of MRIs and maybe a CAT scan or ultrasound. And if I have no needs, I'm off to see my family.
Okay. What do you like best about being a radiologist?
It's a very good question. I think radiology is a unique field of medicine where you are exposed to clinicians in all fields. For example, when I sit in a general seat, I will interpret an obstetrical sonogram, where I will help a pregnant patient determine how their baby looks. I will also interpret a CAT scan if a patient could potentially have pain in their abdomen to see if they have an inflammation such as diverticulitis, which is an inflammation of their large intestine. I can also interpret an MRI where I will determine if a patient has a stroke, and I will call the neurologist. So in radiology, you have to be up to date on the medical journals in multiple fields, and you have to know what's current in the literature, and you're also able to interact with a lot of clinicians. So I think that's very enjoyable about the field of radiology.
Okay. Would you encourage students to go into radiology?
Absolutely. I actually currently interview pre-med students for medical school, and I was also actively involved in interviewing students for radiology residency. And without question, if you like to know a lot about a lot of different fields, if you would like to have patient interaction as a radiologist, if you have interest in information technology and how we use imaging to help make diagnoses on our patients, absolutely. I find the field of radiology is constantly changing. We have input from physicians all throughout the world. It's on the forefront of medicine, and I guess at the end of the day, it's almost impossible for a patient to go see their doctor or to go into the hospital at the very least and not have some type of imaging study performed. So absolutely, I think radiology is a wonderful field, and I'm very fortunate that I am practicing as a radiologist.
Okay, well, thank you for sharing your experiences with the class today.
My pleasure, and I would thank you again for giving me the opportunity to share my experience as a radiologist, and I would encourage any prospective high school students to consider the field, and just bear in the back of the mind for your future opportunities for you. Thanks very much.
All right. Thank you. Bye.
Have a nice day.